Today, we're going to go through a comprehensive breakdown of Medicare costs in 2025. Ultimately, we know that one of the largest reasons that people choose certain Medicare plans is because of the cost. So behind me, you'll see we have Bob, Susan, and Eugene. And what we're going to do is walk through the Medicare costs for all three of them for 2025, whether they have a very healthy year, they're not using a ton of services, or, unfortunately, maybe there is something that goes wrong and they have to utilize a lot of healthcare in 2025. All right, so today we're going to start with Bob, who is just on Original Medicare. And as a reminder, Original Medicare is the red, white, and blue card that you receive from the government. Your Part A, you've paid taxes your whole life for it, so you don't have to pay any more premiums for that. Your Part B in 2025, the premium will be $185. Now, remember, if you are a high earner, we've made another video about how that $185 does increase based on your income 2 years ago. So go ahead and check that if you're curious about that. But what I want to explain today is what a healthy year and a year with a lot of medical expenses would look like for someone just on Original Medicare. So let's start with the healthy year. So Bob is healthy. He's just on Original Medicare. Now, as a reminder, with Original Medicare, that does not cover any prescription drugs. So if you want to just remain on Original Medicare, you still need to purchase a Part D drug plan to go with your Original Medicare, or when you eventually need a Part D drug plan, you'll pay a penalty for every month where you didn't have it. So again, we have other videos about that, but just to kind of dive in here with Bob and his Original Medicare. So monthly, I mentioned earlier, we pay nothing monthly or annually for Part A because you paid taxes your whole life for that. Now, Part B, the $185 a month, or annually $2,220. Now, the prescription drugs, the average in 2025, it really depends on where you're located, but in most areas, I think a $55 average is a pretty good sense for the premiums for 2025. So annualizing that is $660. So, dental, vision, hearing is never included when it comes to Original Medicare. If you fall down the steps and knock out your teeth, Original Medicare is going to fix you. They're never going to make you pretty. But that said, none of that will be included. But, what does that really mean then? Okay, the other thing that we are not looking at here when it comes to Original Medicare are the deductibles. So if it's a healthy year, you're not in the hospital, you just go to the doctor a couple of times a year to do your annual checkup, maybe you go to a dermatologist or something along those lines. Annually, you're going to spend $257 on your Part B deductible. So that's the doctor side of things, that deductible. So $257 plus this $2220 and the $660 is $3,137. So on average, you are going to spend, at least that, because you have to pay the deductible before anything else kicks in. Now, the thing that I mentioned earlier is if you're going to, your annual checkup or your dermatologist or anything like that you do annually, the way Medicare works is then Medicare pays 80% of the appointment after the deductible, you pay 20%. So on average, you would pay, 20% of the cost of any health care on top of this $3,137. So now let's go ahead and say Bob had a medically challenging year and he, something occurred. Here's a great example. Let's say Bob had a knee replacement. And I've read some reports online. There's a hospital system. It's actually really hard to find out how much the general medical, situations cost. That's one thing about the hospitals is it's typically challenging to find that information. But we did read one report online that came from a Tampa hospital system that on average, a knee replacement costs about $100,000. So we have $100,000. Now, we already talked about the $3,137 of all of the premiums and that Part B deductible of the $257. Now, the other thing that we're looking at here is then after the 80% that Medicare covers, then you would pay 20%. So at $100,000, you're then looking at spending around $20,000 towards this. So adding 20,000 on to this 3,137. Now, the thing I didn't mention here is there are some significant Part A deductibles as well for the year. I don't want to go too far into a lot of this, because the other factor about the Part A deductible is if you pay it, let's say you're in the hospital in January, you get out of the hospital, you stay out of the hospital, you go back in June, unfortunately, you have to pay that deductible again. So really what I'm trying to show you here is the sheer cost of if you're just on original Medicare with the Part D drug plan, because there's no maximum out of pockets and there's no cap on your expenses. Because really, if you're looking at it here, what you're going to be spending if you're just on original Medicare, and this is just for a knee replacement 1 year, you would spend the $3,137 plus the $20,000 for the knee replacement. So as you can see, this gets very expensive very quickly. All right, so now we're going to switch and talk about Susan. And before we move into Susan, the thing I really want you to keep in mind is the reason that we don't ever recommend anyone to stay on original Medicare is because of that situation I just described with Bob. And you're really going to see it here as I talk about Susan and Eugene, the sheer cost savings and the difference, because I always feel when it comes to insurance, you have to look at your worst case scenario going in and be prepared for that. So let's go ahead and dive into Susan on a Medicare supplement and look at what that looks like. So like with Bob, anybody on a Medicare supplement, really anybody on a Medicare supplement or a Medicare Advantage, you have to continue to pay your Medicare Part B premium. So you're going to pay that $185 or $2,220 total for the year, regardless of what option you choose. From there, Medicare supplements, they do not include prescription drugs. So we're maintaining this $55 average here, the $660 for the year. Now, just as a quick reminder on Medicare supplements, the way that the Medicare supplements work is you enroll in a Medicare supplement with one insurance company, regardless of which one, the supplement will be the same plan that's offered. So we're using a Plan G today because that's generally thought of as the most popular plan that most people on a supplement these days are selecting. So the way that a Medicare Plan G works is you would pay your Medicare Part B deductible, which is $257 for the year, as I mentioned just with Bob. And then any Medicare covered expenses, anything that is covered by Medicare throughout the year would be covered at 100%. And on top of that, there are no networks when it comes to Medicare supplements. So let's go ahead and look at, for Susan here, if she had a healthy year versus a year with a lot of medical issues. So for a healthy year, as I mentioned earlier, she's going to pay her $2,220 or $185 per month on her Part B. The prescription drugs, and as you notice, I'm only talking about the prescription drug premiums today. We really felt this video would be far longer and more complicated if we went into all the copays. So that's a video for another day. I just want this to be here as a placeholder so you know what you're getting into when it comes to premiums. So dental, vision, and hearing, like with original Medicare, these will not be covered on a Medicare supplement. But let's go ahead and look at plan premiums. So the Plan G premium on average for someone in their, from 65 to maybe their late 60s, they're going to pay right around $150 on average per month. So annualized out, that's $1,800 for the year. Now, the good news is with this, everything else that's covered is covered. So medical issues, you're going, like I said before with Bob, maybe the dermatologist or your annual physical or, colorectal screening or a pap smear. The most you would pay out of pocket would be $257. So what we're going to look at here for the total would be $4,937 for the whole year. So your worst case scenario on a Medicare Part G supplement in a healthy year is $4,937. Now let's go ahead and look at Susan as if she's also having a knee replacement this year and what that would look like for her. Well, the good news is everything maintains the same as it was in a healthy year. And when it comes down to it, since the only thing that you're going to be paying on a Medicare Part G supplement is the Part B deductible, that $257, if Susan had her knee replaced this year, she's quite literally spending the same amount as she would be in a healthy year. So you can see for those people that have a lot of health issues, this is fantastic. So, that kind of really gets to the nitty gritty of why we would recommend, a supplement, or I'll talk about Advantage plans next, over just original Medicare. All right, so let's go ahead and wrap it up here with Eugene, our last example. And Eugene is on a Medicare Advantage plan. And as we discussed before, whether you're on a supplement or an Advantage plan, you do still need to pay your Part B premium. So regardless, we're going to have that $22.20 expense for the year. And the thing I want you to keep in mind about Medicare Advantage plans is these are typically little to no monthly premium. Most of these plans are zero premium, and they do include your prescription drug plans. They include some dental, hearing, vision. They do include some gym memberships, things like that. But these plans are all network-based. So you have to go, they're HMO, where you have to go see network providers, or PPO, where, if you go in network, you pay less than out of network. So important things to note with the Medicare Advantage plan. But let's go ahead. The way these work, instead of paying a higher monthly premium, you're going, like I said, you're going to pay that zero to, some of them have a small premium, and you're going to pay copays for everything you do throughout the year. So let's go ahead and go through a healthy versus a year with a lot of medical expenses for Eugene on his Medicare Advantage plan. So as I mentioned, the $22.20 is going to occur regardless. Now, the prescription drugs, quite frankly, we can just erase this category for Eugene because they're included in his plan. That said, there are some Medicare Advantage plans that do not include Part D drug plans. Some people are on group retiree drug plans, things like that. So there are a couple stipulations there worth mentioning, but the average person does include their Part D drugs with their medical coverage. Now, these plans also include dental, vision, and hearing. All of them vary. Some provide a lot more coverage than others, but these are included. If you fall down the steps on these, they are going to make you look pretty. They're not just going to fix you. Now, so as I mentioned, the plan premium, there isn't any on a Medicare Advantage plan, at least most of them. Now, as I mentioned earlier, though, the medical issues, or when you go to the doctor, there's copays for everything. Now, let's say in a healthy year, we're going to stick with your primary care doc, your dermatologist, a couple appointments like that. I am just going to use an average of $50 here that Eugene would spend for the year on copays. Maybe $5 to go to his primary care, $25 to go to a specialist, et cetera, that type of thing. So just for ease sake, let's go ahead and say $50. So what we're looking at for Eugene in a healthy year on one of these plans, he is spending $22.70. It's obviously significantly less than some of the other options. Now, in a year where, again, let's just stick with the knee replacement. If Eugene is having his knee replaced, again, he's not paying any Part D premium or plan premium, but he's going to pay copays for everything. The good news about a Medicare Advantage plan is the way that these plans work is there is a maximum out of pocket, and you know that before you enroll in the plan. These vary based on the type of plan, but I would say on average in 2025, your max out of pocket for a Medicare Advantage plan would be right around $4,600. So I'm just going to use that as the example for the knee replacement. I'll be frank, Eugene could very well have his knee replaced and get nowhere near that $4,600, but this $4,600 would be encompassing of things like pre-appointment, pre-surgery appointments, physical therapy after the fact, any prescriptions, things like that are what we're really going to be looking at here. So with Eugene's $22.20 and the $4,600, we're going to be looking at $6,820 for the year. That would sort of be Eugene's worst case scenario. So you can see, as we step back and look at all these three, Bob versus Susan versus Eugene, it really depends on your comfort level, your situation, what's going on in your health. There are going to be some years, if you're on a Medicare Advantage plan, where you spend more than others. There's going to be some years on a Medicare Supplement where, quite frankly, you're spending a lot more than you're actually using the care. It truly depends on your specific situation and your comfort level as well. All right, so let's go ahead and recap then what these costs and what the plans really look like, whether you're going the route of Bob on original Medicare, Susan on the Medicare Supplement, or Eugene on the Medicare Advantage Plan. So to kind of start with Bob, the route that I don't recommend generally, which is your original Medicare Part A and Part B. So, for original Medicare, the pro is cheap when healthy. But really, at the end of the day, if you're looking for the least expensive, you still do have to pay your Part D drug costs. So you need to pick up a Part D drug plan to go with it. Whereas on the Advantage plan, that is included in the plan. The cons are really there's no max out of pocket. And I think this is the biggest issue why I would recommend you consider another plan to go with it. The 20%, the 80-20 can pay thousands. There's no dental, vision, or hearing. There's no prescription drugs included. There are, the Part A deductible, you could pay more than one time per year. It really adds up quickly on original Medicare. Now, the example that we used earlier with Bob, if he's having a healthy year, as a recap, it was $28.80 that he was spending out of pocket for the year. And again, as a reminder, none of these include Part D copays. This is just your cost of your Part D premium. We're mainly focusing on the medical element in this video. There will be other videos about Part D drug costs, so check our page for more of that. And the amount, if he was having the knee replaced, would be over $23,000. So that's obviously very significant. Let's go ahead and switch gears here to Susan on the Medicare Supplement. So, the pros are this is less expensive than a Medicare Advantage plan in years when you have a lot of services. It's not a ton less expensive, but it is generally less expensive. Then another pro, this is probably the biggest pro of a Medicare Supplement, is there are no networks. Anyone that accepts Medicare accepts the Medicare Supplement. And, from that, then you get the peace of mind. You know what you're spending on your premium each month. You know you're paying that Part B deductible, and then you don't have any other expenses out of pocket throughout the year when it comes to your medical benefits. The cons then is that premium can get high. The annual cost, things can be higher. And you do have to purchase that Part D drug plan to pair with the Medicare Supplement. So when looking at it, since these don't have a ton of additional copays or out-of-pocket expenses, you're paying your premium and then it's pretty much covering everything. Your cost in a healthy year versus a year when you have a lot of medical expenses, like a knee replacement, would be just under $5,000. Now let's go ahead and switch last here to Eugene on the Medicare Advantage plan. So the good news with these is they are less expensive than the SUP generally. You're not paying any premium for the most part. You're paying copays for everything you do throughout the year. So they're more, you kind of control your expenses with how many times you go to the doctor, that's how many copays you pay, et cetera. These do include your Part D drug plan. So you have one health insurance plan for your medical and your Part D drugs. And last, these do include some dental, vision, and hearing. A lot of these plans also include things like over-the-counter benefits or a gym membership, et cetera. They have some additional benefits associated with them. Now, the cons, the higher cost during medical years when you have a lot of services. If you're in the hospital constantly or you're doing a lot of physical therapy, anything like that, you're paying copays for every single thing you do throughout the year. So those can add up after a while. So to kind of recap then your expenses for the Medicare Advantage plan, you're looking at just under $2,300 in a healthy year for Eugene. And you're looking at $6,820 if you're kind of hitting that maximum out of pocket for the year. And as a recap, all of these out-of-pocket expenses and all of these totals for the year, they do include your Part B premium, which generally is one of the more significant elements of your healthcare when you're on Medicare. So, you might want to go ahead if you're curious about the Part B premiums. We just recorded a video a few weeks ago, and that's on our page as well. If you want to take a look, if you are higher income, you might want to watch those videos to see what instead of the $185, what your Medicare Part B cost will be for next year. But ultimately, at the end of the day, if you have questions, we work with people like Bob, Susan, or Eugene every single day. We can really show you what these expenses would be for your specific health situation, whether you look at a Medicare Advantage or a Medicare Supplement. This is all we do, and we're happy to help you in any way that we can.